warahmatullahi wabarakatuh. Hello everyone, my name is Sani Ega. My research team, Miss Sani Ega Priani, Mr. Suwendar, Miss Dena Mulyanti, Miss Mentari Lutfika Dewi, and Miss Sahra Jusatika. We are from Pharmacy Program Universitas Islam Bandung. Our research is based on community service activity that was held in March 2022, which is about the training of diabetes mellitus support therapy through a non-pharmacological and Islamic approach at Tamansari, Bandung City. The objective of this community service activity are to improve the knowledge of the community regarding support therapy for diabetes mellitus through a non-pharmacological and probiotic medicine approach. We will present the result of research at Bandung Annual International Conference 2022 on October 18. We are looking forward to all of you to join us on the seminar. Thank you for watching this video.
Assalamualaikum warahmatullahi wabarakatuh. Good day everyone, my name is Sani Ega. My research team, Miss Sani Ega Priani, Mr. Suwendar, Miss Dina Mulyanti, Miss Mentari Lutfika Dewi, and Miss Sahra Jusatika Putri. We are from Pharmacy Program Universitas Islam Bandung. I would like to deliver our research under the title Training of Diabetes Mellitus Support Therapy through a Non-Pharmacological and Islamic Approach at Tamansari, Bandung City on the 5th Bandung Annual International Conference Science and Technology Research Symposium 2022. Here's our outline on the presentation, ladies and gentlemen. The first one is introduction, and then method, result, conclusion, and acknowledgement. The first part of this presentation is introduction. Diabetes mellitus is a metabolic disorder categorized as a non-communicable disease, characterized by hyperglycemia resulting from defect in insulin secretion, insulin action, or both. The chronic hyperglycemia of diabetes is associated with long-term damage, dysfunction, and a failure of various organs, especially the eyes, kidney, nerves, heart, and blood vessels. International Diabetes Federation in 2021, around 537 million people in the age range of 20 until 79 years are living with diabetes, predicted to increase in 787 million people by 2045. Riskesdas 2018 data, people with diabetes mellitus continue to increase, where the prevalence reaching 2% for 15 years of age. In the West Java, the number of the people with diabetes increased from 1.3% in 2013 to 1.7% in 2018. The vast majority of cases of diabetes fall into two broad etiopathogenetic categories. In one category is type 1 diabetes, the cause is an absolute deficiency of insulin secretion. Individuals at increased risk of developing this type of diabetes can often be identified by serological evidence of an autoimmune pathologic process occurring in the pancreatic islets and by genetic markers. In the other, much more prevalent category, type 2 diabetes, the cause is a combination of resistance to insulin action and an inadequate compensatory insulin secretory response. Type 2 diabetes mellitus is the most common and reach about 90% of a total diabetes cases. Gestational diabetes is defined as any degree of glucose intolerance with onset or first recognition during pregnancy. The definition applies regardless of whatever insulin or only diet modification is used for treatment or whether the condition persists after pregnancy. Therapy for diabetes mellitus can be done either pharmacologically or non-pharmacologically. The pharmacological treatment depends on the type of the disease and the patient pathological condition. For type 1 diabetes mellitus, the primary treatment is the parenteral administration of insulin. And for the type 2 diabetes, treatment generally use oral anti-diabetic drugs. In addition, the synthetic drugs diabetes mellitus therapy with the provision of herbs or other natural compounds is also widely practiced. The use of appropriate herbal ingredients can support diabetes mellitus therapy. And for the non-pharmacologically treatment, there's a lifestyle change can help too. In addition to the previously described therapies, there is a probiotic medicine or tib nabawi in Islam. include using natural ingredients, cupping, zikir, and wudu. Prophetic medicine is the Prophet Muhammad's advice regarding sickness and treatment as found in the Quran or Hadith. Several scientific studies has proven that natural ingredients included in prophetic medicine can support diabetes mellitus therapy. These natural ingredients include black cumin, ginger, garlic, olive oil, honey, apple cider vinegars, and dates. The purpose of this community service activity is to improve the knowledge of the community regarding support therapy for diabetes mellitus through a non-pharmacological and prophetic medicine approach. The training program was conducted for PKK cadres in Tamansari Subdistrict, Bandung City. PKK cadres are expected to be able to share the information or skill obtained with the broader community. The method that we use in these community service activities are carried out as training for trainers for PKK cadres in Tamansari, Bandung, held on Wednesday, March 23 to 2022. The training was not given directly to the broader community at the same time, but only to community groups who were considered to be able to deliver or provide education to other community groups. The training is divided into three parts. The first one is education about diabetes mellitus related to definition, symptoms, diagnosis, risk of complication, and prevention method to PKK cadres. Training on non-pharmacological therapy for diabetes mellitus. And the last one, training on the use of prophetic medicine to support diabetes mellitus therapy. As a method of evaluation, pre-tests and post-tests were carried out for PKK cadres before and after the training activities. The result of the pre-test and the post-test data were analyzed to assess the level of success of the training activities. Before this community service activity, a study about non-pharmacological therapy and prophetic medicine to help treat diabetes mellitus was done. Referring to the latest scientific publication and the Quran and Hadith, a non-pharmacological therapy for diabetes mellitus can be done with diet intervention, exercise, stress management, and the other lifestyle changes. Training about prophetic medicine in diabetes mellitus therapy explain how to use black cumin, garlic, ginger, honey, dates, olive oil, apple cider vinegar, which has been scientifically proven to be able to help treat diabetes mellitus. Community service activities in the form of training of trainers were actively followed by PKK cadres at Tamansari Village, Bandung. The result of the pre-test and post-test analysis are shown in the table. Related to the three things, the first one is participant understanding of diabetes, the second one is non-pharmacological therapy, and the last one is the use of prophetic medicine. From the data in the table, it is known that the training activities success in increasing the cadres' knowledge about diabetes mellitus, non-pharmacological therapy methods, and the use of prophet medicine. The highest increase in knowledge was shown in the training on the use of prophetic medicine for the treatment of diabetes mellitus, which indicate that before the training activities, the community knowledge about the prophetic medicine was still poor, which can be seen that from the pre-test score of only 20. The training activities successfully increased the cadres' knowledge about the use of prophetic medicine, so it grew to around 250%. Community service program conducted for PKK cadres in Tamansari, Bandung have success in increasing public knowledge related to diabetes mellitus disease, non-pharmacological treatment for diabetes mellitus, and the use of prophetic medical data supportive therapy of diabetes mellitus, with the percentage of the increase are 24.39, 40.43, 253.33 respectively. We want to express our deepest gratitude to the PKK cadres in Tamansari Village who is willing to be conducive partner in this community service program. We also thank the Research Center, LPPM, and Faculty of Mathematics and Natural Science Unisba for the funding support for this program. Thank you very much for your attention. Wassalamualaikum warahmatullahi wabarakatuh.